Okay, we're going to go ahead and call the meeting to order. It is Tuesday, October 31st, 2023. Happy Halloween. Please stand for the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Morning up, board.
Okay. Minutes and reports received and filed.
Yes, we have the treasurer's August and September 2023 reconciliation.
Okay. Commissioner Committee liaison reports, upcoming meetings and events.
Alrighty, we have a bunch of stuff going on. We got the kickoff special project for the Jeff City Regional Economic Planning at the JC Parking Garage at 10 o'clock if we get done early enough today. Communities Thursday morning. Solid Waste Advisory Board Thursday. We got the small grants. We'll be reviewing those and scoring them. Cole County Extension Thursday evening. Chamber Business Summit Thursday afternoon. Eastside Business Association Friday. Central Missouri Foster Care and Adoption putting on the Ritz Gala Friday night. St. Thomas Fall Fantasy Night Saturday night. Disabled American Veterans Barbecue out off of Monticello this Saturday as well. And then we fall back for daylight savings on Sunday, and got St. Francis Xavier Fall Supper from 11 to 6 Sunday. Osage Fire Protection District and Cole County EMS are celebrating their expansion, doing an open house from 11 to 1 at the Wardsville facility. HBA Parade of Homes is Sunday as well, and then we're going to be celebrating Debbie's birthday early Saturday since we're falling back an hour, right? Hey, if you say you're going to quit having birthdays, that means you can't retire. And
Yeah,
we're
that's
okay
right.
with that.
Yeah.
So, yeah, so happy early birthday. I think that's it.
If we all had that much, we're not gonna make that 10 o'clock meeting.
Yeah. It's
So,
cold outside, though. It's all right.
Yeah.
I'm gonna meet with Brian Crane this afternoon. I think both of you have already met with Brian. There's a Missouri State Tax Commission meeting this afternoon I'm interested in. I may have a U.S. Army Corps of Engineer boat trip on Thursday. You mentioned Cole County Communities on Thursday, West Side Business Association Thursday, and I think that's all I have.
Okay. Yeah, I've got the JC rep thing. Cap Region today, Dr. Diane Light's retiring, so there's a reception for her. Wednesday, I'm going to be on KWAS, and I've got a business lunch with Christy, their communities. Saturday is the downtown sip and shop, and Linda and I are going to be helping decant spirits at American Shoe, so stop in and say hi. And then, yeah, I've got St. Francis Fall Supper. That's it. Okay, presentation from staff, consultants, invited guests, the 2023 Toys for Tots campaign kickoff. Chief.
Thank you.
Thank you, sir.
Morning. So tomorrow kicks off our third annual, at least for EMS, Toys for Tots toy drive campaign. This year, community remains in need, so we have continued to increase our goal. The goal this year is 4 ambulances full of toys. In-house, we've done a lot of work leading up to this and have tried to make it a more well-rounded event other than just putting out boxes. So in front of you there, you have our calendar of events. A couple things that we want to highlight is November 8th. We've partnered with Scooters Coffee on the Boulevard. They're going to be donating 20% of their entire sales for that day to Toys for Tots. So if we could encourage county employees to take a coffee break and make sure that that word gets spread in the community. And then I believe the date is December 9th will be our second annual holiday extravaganza. Haven't really decided on the best name, Touch a Truck, Trucks for Toys, whatever you want to call it. That'll be held at Capitol West Event Center. Santa will be arriving by helicopter. We'll have all of the emergency vehicles out for display. There'll be games, snacks, Christmas, holiday fun. There will be an opportunity for a picture with Santa. All of that is included for free with the donation of a toy. And then we've also partnered with local vendors for a raffle. So the highest priced item at this point is a Blackstone grill from one of our local vendors that will be offering raffling away, and you'll get entry into the drawing with the donation of a toy. So we'd appreciate everybody's assistance in spreading the word. We'll also be at Living Windows and the Christmas Parade, raising awareness and trying to capture toys as well. So happy to answer any questions.
I don't have any questions.
No, it's great, and I appreciate,
Nice job.
county employees will have boxes everywhere,
Yep.
so if they would just pick up a toy when they're doing some of their other Christmas shopping, it is appreciated.
So I just ask for the three of you, as you make your travels through your long list of events, help us raise awareness. We had about 200 people show up to last year's toy drive event. We're hoping to get a lot more people out. One of the big things is that a lot of people said that they didn't know about it, but they thought it would be a very large event if we could market it. There's some barriers to getting it into the schools and that sort of stuff. So we hope that we can pound it through social media, and with the assistance of you guys spreading the words, we can build a bigger following this year.
Could Jeff get his picture taken with Santa?
Absolutely.
There you go, Jeff.
Can we schedule these things in like July or sometime when it's not deer season?
No, sorry.
So y'all doing the blood donation thing is on a Saturday then?
Yeah, so there's one of the other things that we've kind of lumped into this that's a little bit separate from Toys for Tots is we're going to be doing a fall blood drive centered around Thanksgiving. One of the things that we'll touch on here just briefly is that over the last 10 months, 11 patients have received blood as part of our pre-hospital blood transfusion product. Those life-saving interventions wouldn't be available in the community unless we had donors who came out and donated blood. So it is a need. You break that down, that's a little over one time per month that somebody's receiving those blood products in the back of an ambulance. So if we don't have those available, it does become a hindrance to patient care. And again, we are one of the only organizations in the state that offers that. So I feel as a community, we owe that to come out and donate and support that program. And without the help of donors, it wouldn't be possible. So,
Great. Thank you, Chief.
Awesome.
Thanks.
Chief.
yep.
Yeah, we started out with 2 ambulances, 3 last year.
Yes.
4 this year.
4 this year.
Yep.
Just keep going.
Yep.
Big toys, right?
Okay. Any commission comments? Bids and contracts. Approval of fire alarm upgrade quote for the health department.
Hello, we've talked about this a couple times. So we did get one bid to upgrade our fire alarm system and get it functioning again. We called a couple other companies and did not get a response from them. Jessica worked on that. So I think you got in your packet last week, and we wanted to kind of get informal okay or approval from the fire department, and we did receive that this week. So the bid is for $8,700, and we'd asked for approval of that today so we can get our fire alarm functioning again.
I was trying to remember what your last email said. So you got all your questions answered?
We did.
Okay. So, yeah, I'm good with it. We need to get it working. So,
Yep.
yeah. Do you have a contractor or anything, or?
I got
Okay. Oh, you got it, okay.
from,
Is this sales tax or is this coming out of your grants?
There's actually sales.
make a motion to approve the Coursemeyer Fire Protection LLC estimate $8,700 for the Health Department fire alarm fire protection.
Second.
All in favor?
Aye.
Aye. Okay. Approval and signing of agreement for professional engineering services for Hickory Hill Road.
So this agreement is with Miko Engineering for a not to exceed amount of $118,690. With this agreement, Miko Engineering will provide professional engineering services to design and prepare engineering plans to upgrade Hickory Hill from gravel to a hard surface.
Alrighty, we got that, that's part of our
Sales
gravel
tax.
road upgrade program, so.
Yep.
Yep.
Give it to Eastern District.
Got the east side.
Yeah, yeah.
I didn't know we had any gravel roads on the east side, so we had like 2 of them left. All right, I'll make a motion to sign the agreement with Miko Engineering for the professional engineering services for Hickory Hill Road.
Second.
All in favor?
Aye.
Aye.
Okay, approval of payment of supplemental reimbursement, non-federal share for SFY 2021 GEMT.
So if you'll remember, a few weeks ago, you signed and accepted the interim cost report for SFY 2021 GEMT recoupment. They have gone ahead and now issued the final reconciliation in which they've determined that we are due an additional $27,904.03. To receive that payment, we do have to make the non-federal share deposit of $9,735.32. This will close GEMT for the year 2021, bringing us with only the year 2022 outstanding.
I'm good.
All right. Do we have paperwork on this?
Yeah.
Oh, I'm sorry.
Right there, sir.
I'll make a motion to approve the we lost it. Supplemental reimbursement, non-federal share for the SFY 2021 GEMT.
Second.
All in favor?
Aye.
Thank you.
Okay. Approval of Zimmer Media contracts for the Sheriff's Department. And John has a great face for radio.
Thank you, sir. I agree with you. So what we're trying to do is we're pushing farther with Zimmer on trying to get not only our brand, but also get the message out that we're looking for hirees. As of today, we're 18 down. We are actually holding our own. We brought 5 on conditional over the past month and a half. Unfortunately, we're still losing a few to the state. What it is with the social media, these are both the moderate plans that they gave me. The social media portion, which would include $1,200 in Facebook ads, and it's their whole team working on it, is $3,900 a month. And then the Polk County, the annual radio is going to be $6,400 a month, but this includes Cat Country and KCMQ 96.7 also. So they're 2 a little bit different demographics that we're putting a message out. And the KCMQ, of course, is a bigger window. So I'd ask that you sign both of these. It is a year contract that we're wanting you to sign today. However, we can opt out after 30 days. I made it blatantly clear that we were going to do this for 3 months and see where we're at. So hopefully it brings us more people.
And Sheriff, you can track whether it does or does not?
Yeah, we actually, you guys approved the budget for the application recently, and on there, we were able to put a spot on there and how they heard about it, so we can do that. And then just as recently as, I think it was yesterday, Captain Harlan got a notification. I think he said that on Monday, over the weekend, he had 20 people that he was sending messages to. Now, they didn't fill out an application, but they were calling and asking questions. So now, out of those 20, how many will actually fill out an application? We don't know. So, but it's still getting leads out there, so that's good.
Now, something else is working too. I mean, you have added some warm bodies recently.
Yes, we have.
You
So
know-
we're still losing people to the state, but we're still picking people up. So it's a wish for wash right now. And what I'm hoping we do here is to push us over the hump and get us back into some better numbers.
Do you know where the new ones that you do have come from? Or
We had
how they
one
found out
that-
about
I
us?
think there was one that went to Patrol Division, and then we had, I think, 3 that went to the jail.
But well, where did they come from? How did
We
they
had
find
one
out about
coming
you?
One came from corrections, and then I think the other ones were just people just out there. I don't think there was any specific, they weren't changing careers. Now, we are talking to a couple that are local law enforcement agencies or people that's working for local law enforcement agencies that are coming to work for us, but they're just not there yet.
Okay,
And I don't want to divulge their name on the radio, on the, over the air, so.
right.
Well, just tell Alex.
And the good news is, EMS hasn't stole any more people from me so far, so
Still early.
still early. Challenge accepted.
Yeah, I'm not crazy, but we still need to keep pushing and try to fill these positions. We've done some salary adjustments and stuff. This is one way to get it out there. And let's try to keep getting them spots filled.
I agree, and I would ask the sheriff, could you, give us the success stories as soon as they happen, or if they don't?
Absolutely. So part of this deal is they're going to send us reports. And if you want to, I will forward those reports on to you because it will tell you, like on the social media, how many people are clicking on our ad. I'll send you the ad that they've come up with. It's a great ad.
Well,
Couple of them.
those will all be bites. I want you to land the fish.
I understand, sir. Yes, sir. We
Okay.
will.
All right.
Yeah.
Okay.
Okay, I'll make a motion to approve the sheriff's request on the Zimmer Media contracts.
Second.
All in favor?
Aye.
Aye. Approval of security electronics engineer selection for the sheriff's department.
So, one of the biggest reasons we did the data room project was to change our security envelope in our facility. It's antiquated, it's 11 years old, and we need to upgrade. To do that, that means we had to have a room to put all that security electronics in because we don't have any. So that's one of the reasons why we built that data room. With building the data room now we can move forward with the RFP. I simply was going to contact Callaway County and have them send me, because they just recently had a bill that they agreed to send me their RFP for their security envelope. And hopefully I would just be able to, I can't remember what, Harry, you said, cut and paste CPA?
Cut, paste, and assemble.
Yeah, that's right. So I was hoping to be able to do that, but it's way too technical. There's no way. My staff and I have been looking at it, and it's just way too technical for us to deal with. So what I'd like to do is I'm going to reach out to some vendors, not vendors, probably engineers, and have them to write the specs for this. They will charge us professional service. I'm not sure. That could be anywhere from $30,000 to $80,000, but you're talking about probably a $1.5 million project, because we're changing out all the cameras, going to digital. They're analog right now. Going all the digital cameras, they have to pull all the wires, and then they have to adjust and put all the new security electronics, touch screens, all that.
We didn't get to talk about this too much before we came in here, John. Is this something we can do as a design build project? Where they design it themselves instead of us having to put the specs out there? I mean, do
So
we
I
know
talked
what
to-
we want?
Yeah, I talked to a couple of vendors, and what they said is what most people do is they reach out to a particular vendor that deals with this, and then they meet with the staff. And I was also going to, I don't know if the EMS building has already got its security electronics built up into it or not, but I was going to invite Eric to sit in on these if it's something that he wants to jump on also. But if they said they meet just like they do a building design, and you sit down and you tell them what they want, and then we give them a schematic of our facility showing where we want the cameras at, And then they look at them and say, well, if you want this camera to show this room, you really don't need 2 cameras. This camera they have now, the technology will let you blah, blah, blah. And so they go down and work with us on all the way down. So is it a design build? I think it is, but I think it's through a vendor how we do it.
Don't we have issues right here in this building and the building adjacent to us we have more asks than can be responded to with respect to officials and employees want to know what's coming in and out the doors, and we're locked. So,
You can only have so many people logged into it.
right,
One
and so
time
sometimes the
access.
bailiffs can't read a camera because somebody else is on the camera at the same time. And we're probably antiquated right here, aren't we?
If your system's more than a year old, it's antiquated probably nowadays, so, yeah. And I don't know when, and that's a Brian question, I don't know when the last time all that was upgraded, so.
Okay.
And Brian is definitely gonna be part of this conversation. I mean, I'm not gonna do anything with cybersecurity or anything unless he's in the room.
So what is the ask for today?
I'm just wanting your permission to go forward with looking for this vendor for the proposal. What I didn't want to do is go forward and try to find somebody and then come back and you guys, no, that's not what we want to do. So I don't want to go through the effort. It may be some cost involved in it. I don't know what that would be. Before I would spend any money, of course, I would come to you guys. but-
Okay.
I'm okay with you looking into it, but I think you threw some kind of a price range out there that was pretty significant, so I'd like to know kind of where we're at with it, and if you can get an idea of what Callaway spent on it.
And I think it depends upon the group that you go to. So, and like I said, I've got a couple people that's just had some work done in their facilities. So, and I've been talking to them, a couple other sheriffs, and so they're helping me, guide me in the right direction. I think I just keep pushing forward.
Yeah, I mean, just, I guess whenever
I
you get a
think-
price tag together, get an idea together.
Probably too, if we're doing this, maybe look at the courthouse as well, because
I don't have a problem with that. The only issue or only thing that I would bring up is master control in our facility controls everything in our facility. They have the ability to control everything in our facility. And what I would ask that we do not put anything in these buildings over, because they're doing
No,
enough as it
no,
is. I don't want
no.
any more additional responsibilities or additional duties for those individuals.
Okay. Thank
All
you.
right, I'll push forward. Thank you.
okay. Approval of body cam maintenance agreement for the sheriff's department.
So this is through Turnkey Mobile. We bought those new body cams. We had the cloud-based system. It was gonna cost us $62,000 a year. And it was all fine and good until it didn't work. So that was an issue. So we punted, we bought a server instead of having it be in a cloud. We brought it down to, and had Brian install it. Now it's going to be $9,700 instead of, actually it's $9,795 a year instead of the 62. So it's a little bit of savings for us, a little bit more work for Brian, which I'm okay with. Is it your?
No.
No,
This was Brian's idea.
All right, you're good with it?
Yes.
Okay, make a motion to approve and sign the annual maintenance agreement with Turnkey Mobile for the body cam or body worn cameras.
Second.
all in favor?
Aye.
Aye. Okay, do we have any unfinished business? New business, accounts payable review.
I'd ask for approval of accounts payable pending review.
I got one in there. Can you handle it? Yeah, I've
Yeah.
got a mileage
Okay.
in there.
Make a motion to approve accounts payable upon review.
I second. All in favor?
Aye.
Abstain.
Okay. Discussion and approval of the county's health, dental, vision, and group life insurance for the calendar year 2024.
Oh, the fun stuff.
I want to do just like we just did on the accounts payable and just say, let's approve that.
Go get it, Joe.
You know, you gotta try. Right now, we're actually looking at the stop loss. As you know, we have UMRA as our TPA, and their rates are in a hold, so there'll be no change to the UMR rates. The initial blush of this stop-loss renewal came in very high because we've had a pretty high claim year. Randy was able to negotiate with Sun Life and has had it reduced now considerably. And we're asking that you change the specific from 75,000, which means that we're liable for the first 75,000 of claims, and then after that, the reinsurance picks up. We're asking that we move that up to 85 because the rates are allowing us to do that this year. And then approve that at the renal option number 2. The dental is taking a 5% increase. The vision, basic life remain in rate hold. And by doing the dental at the increase of 5%, we're gonna get another 2-year rate hold overall on all the products.
So basically, I sent you guys an email. They did a great job on the renewal. You can still see with option 2 that fixed cost is going up at 11%, and they're recommending the different rates per different types of employee, employee and spouse, employee and children, employee and family. Due to that, and due to us not increasing the rates since 2018, we've had the same rate that we charge the employees. Keep in mind, we've kept it that way because you're partially self-funded, and the account was funded very well, so we could do that, not changing the rates for 6 years. This year, going into 2024, I would suggest we increase that to 5.6%. 5.6% is basically the overall cost that the underwriters and the stop loss is coming up with. The 5.6% is what we should increase to. And still taking option 2, you're taking on a little bit more liability from going to the 75 to the 85. Recognizing that and the fixed cost increase, I think that 5.6 is where we need to be. And still funding the employee fully. So the only ones that would actually take a hit, if you would say that, is people that carry children, family, or their spouse. And just so you keep in mind that a 5.6, if you had children, you would be at a $91 now a check, and you go to 96. So it's not really that much money, but it does keep up with the times.
The one big question we had as we sat and discussed this a week or so ago, and we used the L word, laser. You want to explain?
This contract is a no laser contract.
Correct.
That we have with Sun Life. It also has a 50% cap on a rate increase. No laser means that no individual person's claims are lasered at a higher specific because of what that particular claim is. It's very important to not have a laser contract if you can keep from it.
Right.
It does save money. And the suggestion of moving to the 85, this year we had approximately 6 people that went over our specific.
Right.
And so with the change in the rate, you're still gonna be saving money in the long run to go to this $85,000 specific.
If, as I recall from our meeting, if we had a similar experience in '24 as we've had in '23, the same population of covered belly buttons, is that the term you use? We have the same number of belly buttons, and let's say we have the same number that expand over the limit, 6. It costs us an extra $60,000 to cover those.
Correct.
But on the other side, we're saving $100,000
Saving $100,000
on a premium.
in the
So
premium.
that's the best we can project at this time.
And I think this is the first year we've had that many that have gone over the
Yes.
specific.
And we're staying with Smith RX on prescription.
Correct.
That's
And that has helped this past year.
that's been
And-
wonderful.
And all the suggestions that we've changed in the last 6 years through Wall Street suggestions to the plan
Yeah.
has made it easier for us to stay at a steady for 6 years.
And I think there've been a few stumbles with Smith at the very beginning of the year, but I think we've ironed all that out, and I still ask that they contact me if they have any problems with it, and I'm happy to help.
And finally, just for the listening audience and the room and the whole Cole County family, the issues between Anthem and JCMG are not appropriate, or they don't concern us at all because we're
They
not,
have nothing to do with
we're
United.
not Anthem.
And, you know, they're always gonna have contract issues.
Right.
Aetna had it last year with Boone, and United could have it with, someone here locally, we just never know. But currently, all of those contracts are in place. We are not hearing any hubbub of any problems with United whatsoever,
Good.
or their networks, which is good. As far as addressing the JCMG, we don't know anything yet. That's still set to go as they're saying right now, unless we hear otherwise.
Right.
Yeah, I don't have any questions. I love this stuff.
I can tell.
I'm just glad we've been able to hold it, you know.
I'll let you go to the meetings next year, Jeff, if you love it that much. No, Wall Street's done a great job, and I know we were concerned initially with our experience and what was going to happen. You shopped it well, and
And we did shop to other stop-loss carriers, and Sun Life is still the best option.
I will share this with the group. The one little heartburn I have is that, in a sense, is that, okay, we fully cover the expense for the worker. But we don't say anything to the worker about, maybe you ought to knock off that nicotine. A year from now, when we're sitting here, I'm going to suggest that you only get that good break if you take the non-nicotine pledge. But I couldn't get that through this year. I'll be back next year trying to get that done.
And it is a gift, whether the employees realize it or not, for the county to still fund the employee fully. You don't see that at too many employee
Right.
employment. I understand.
Debbie's correct.
Yeah.
There aren't many employers anymore that can pay the full employee premium, so the county workers are very fortunate that that still happens for them.
That's a great benefit.
Yeah, this is the first year I heard about the laser thing too. I don't even want to get down into that one.
That's in the weeds for you, Jeff?
Oh my, yeah, that's way down in there. I know there's other companies or entities around here that have had some laser, whatever you call it, and so. Yep, so what do we need to do today, Debbie?
Well, I'd ask you to approve Sun Life Financial as the stop-loss carrier, and this is the form. Sam, you'll initialize if you guys agree to an $85,000 stop-loss amount, and then if you could sign that first, if you'd approve that, so.
I'm going to make a motion and use the language that Debbie had for our health insurance coverage for calendar '24.
Just a stop-loss agreement with Sun Life Financial.
Okay, and option 2, right?
Option 2, right.
Okay, yep, second.
Any other discussion?
Just to approve the Sun Life dental, vision, and those renewals on your ancillary products with the 5% increase to the dental.
Okay,
As part of that motion, that is included.
Yeah,
okay.
I'll
And
accept
then
that
maybe
as a,
as a separate motion,
All
sorry,
right.
to approve the rates at 5.6 for health, for dependents. Still, you guys assuming half of the dependent cost is a big deal with, for the county to do that for dependents, but it would go up 5.5%, and dental going up 5%. So if you would.
you just want to do Sun Life as the stop loss, we'll get that one done first and then do that?
Yeah, let's do this one
separate?
second. Yeah.
Okay, all right, so
So-
you see where we're going with this, Dawn?
Sure.
The first part of it was for the Sun Life as a stop loss.
Okay,
All right.
And
Okay.
then also.
Wait. Let's finish this first one.
okay,
Oh,
All right.
okay. And you had made a motion, you seconded,
Yep.
so that we're doing for Sun Life. All in favor?
Aye.
Okay,
and then the rates, be it the rates that are submitted with the 5.6 on health and the 5 on dental, and plus the HSA amount that the county just gives to employees that take the HSA. I would like to set that at $100 a month. That's about a 5.6% increase.
So moved.
Second.
okay. Anything else?
No more
What-
events, Debbie.
We got a vote.
Oh, yeah, I know. That's-
All right.
You just asked if Debbie was she's tacking some more on there
Yeah.
for us.
Oh, I see.
Okay.
So moved, yes. And you seconded it?
Yeah.
Okay, all in favor?
Aye.
Thank you, gentlemen.
All right, thank you all.
Can't write on this yellow, though, it doesn't. Pencil writing.
That was a
That's
lot
all.
faster
Let you
than
write on
it is.
Alex, I want your story to say, according to, gosh, what's the guy's name? I've lost it now. No Laser. Austin
Oh,
Powers.
Austin Powers.
Yeah.
The shark with the laser.
Okay, by golly,
$1 million.
we breezed through that. Do we have any other issues? Christie?
Speaking of health, don't forget tomorrow we have that drive-through flu clinic, flu shot, for anybody can come through from 12 to 6. So don't even have to get out of your car. You can come right on through. We'll do insurance, employees, of course it's free if they miss the employee clinic, but 12 to 6. And then also, now that we're back fully staffed with nurses, knock on wood, we're gonna do some more worksite wellness stuff this year. We wanted to do the biometrics again. And if you like, we could do some things on tobacco cessation. Kind of get it ramped up. If you have any thoughts of doing that next year, we can start with the tobacco cessation. We have access to some pretty good tools through the state with that.
That'd be good, for the wellness reserve, that'd be good. Also, I want to remind now that those are set, we're going to have open enrollment for health, dental, life, vision, and it's going to start November 6th, 8th, and 9th, and there'll be an email go out about it. And again, if you don't want to make any changes, you probably don't need to come, but if you want more information, those are always a great place to come. Change your beneficiaries, change whatever you need for the next year. No, we're going to.
Oh, okay.
And then the SURF retirement and their SURF deferred is adding an additional option for 24. So come find out about that at open enrollment. Okay.
Okay. Anything else?
10 o'clock.
Yeah,
We do too.
it's gonna be awfully cold, though. I might sit in my car with the engine running. They're like a park up on 5.
Can I ride with you? I don't think my truck fits in there.
Anything else?
I
All
hope
right.
not.
I'll make a motion to sit in recess until 4:30.
Second.
All in favor?
Aye.
Aye.
Thanks, guys.
Thank you. You got your email on that? Yep.